This video will demonstrate the multifactorial risk assessment custom form. We are here in a fictitious patient who is 67 years of age. We do see that the patient was screened as being at high risk of recurrence for falls. In conclusion, this patient requires additional assessment such as performing the multifactorial risk assessment for falls. Let's go to F2, Falls, Multifactorial Risk Assessment, which brings us to the custom form. You will see here that the custom form pulls in the information of the patient name, date of birth, phone number, and address, along with the physician's name, phone number, fax number, and address. Let's proceed to the items within the multifactorial risk assessment. We now see the first item is to document the history of falls. And in this box, we would actually add the circumstances related to the fall. Let's say this patient tripped on the carpet. We want to identify also any acute or fluctuating medical conditions. We can actually here say this patient is a diabetic patient that suffers from hypoglycemia, along with any other chronic medical condition. In particular, osteoporosis would make us be concerned about higher risk for suffering consequences of falls such as fractures. We can then proceed on to putting the result of the MOCA test. And here you will see the next three items, which are bolded in red, which are called the 3 Ps. These are 3 of the significant factors that can be modified in order to prevent further falls. Postural hypotension. If we record a blood pressure at having more than 20 millimeter of mercury of drop, this is significant, especially if the patient is symptomatic. In this area, we can also record the heart rate and rhythm. In particular, if the heart rate is irregular, such as occurs in atrial fibrillation, this would increase our index of suspicion in our patient's recurrence risk for falls. The second P of the 3 Ps are pills and medications, prescriptions over the counter, psychoactive medication, and polypharmacy. And finally, the third P being pain, gait, balance, and mobility problems. In this item, we will review the stand up and go results, reduce muscle strength, decrease upper body strength, pain related to mobility, unable to retrieve item from floor, decrease extremity strength, or being unable to rise independently from a chair without the use of arm rest or assistance. The next item relates to impaired vision, followed by neurological impairments, along with the Romberg sign. We do see here that our patient has been also assessed with a bone mineral density that was said to be at moderate risk, but at a level in which there was good evidence that the patient would benefit from pharmacotherapy. Let's go back to our multifactorial risk assessment. This patient was deemed to be at higher risk for fracture based on prior fractures. We then evaluate feet and footwear, environmental hazards, assessment of depression and behavioral risk, client's perceived functional ability or fear related to falling. In this final section, you will see a description of the time up and go test along with the interpretation of the test. That is, if a patient takes greater than 14 seconds to do the TUG, this relates to a higher risk for falls.